Next tonight, a Trump administration raising questions about the future of the Affordable Care Act.
While some small businesses would like to see changes to Obamacare, others who rely on health insurance through the marketplace are left with a lot of questions. Valina Jones has more on what both sides are facing. Valina?
Well, there certainly is a lot of questions surrounding what changes will be made by President-elect Trump, leaving both businesses and the uninsured waiting for what's next. Now, the prospect of changes to the law is welcomed by some and frightening for others.
Phone has been, just ringing off the hook.
With open enrollment and a new presidency to come, businesses like the health insurance store have seen a spike in customers with a lot of questions.
People just have a million questions about, what's going to happen to my current coverage, what's going to happen if I enroll on the marketplace.
During his campaign, President-elect Trump vowed to immediately repeal or replace the Affordable Care Act if elected.
The rates are going through the sky. We all knew that. I knew it before it was passed.
Now he says he's open to keeping some provisions.
All we do know, really, from what the experts are saying out there, is that nothing is going to happen today, tomorrow, next year, quite frankly. It just wouldn't be possible to do something that quickly.
One of the first things that went through my mind was whether I would have coverage starting next year.
Up until now, Minju Lee was uninsured working for a private family. Despite the unknown, she says she can't afford not to have insurance.
I just don't know what would happen if Obamacare wasn't available. Being a single person and working for a private family, I don't have those opportunities through a traditional workplace.
Small businesses like Dane Manufacturing with 65 employees hopes Trump's plan will come with some relief for their company that has seen premiums go up 15% every year.
We work within it, but there's certainly things that we'd like to see changed about the law. Yeah.
Under the Affordable Care Act, they have had to switch insurance plans. Lyle says the cost and complexity of the law has piled on more work for the company. Even then, he sees some benefits for keeping measures of the plan intact.
It's probably worse to just throw it all out than to make some changes at the margins or at some major pieces. I would say that for a lot of people within the population, it's asking to cover things that aren't necessarily what everyone wants covered.
Now, those who are uninsured have until December 15th to enroll or change plans for coverage that begins on January 1st and until January 31st to enroll in or change a 2017 health care plan.
Valina Jones reporting from the studio tonight. Thank you, Valina.